Ion Health aortic valve stenosis, which is when the heart valve narrows, restricting blood flow, is one of the most common heart issues someone older than 65 can get. Luckily, treating it has become less invasive with better outcomes over the years. At Palm Beach Gardens Medical Center, they are using advanced techniques to treat this common issue. And here to tell us more about it is Dr. Jacob Litwinczuk. He's the doctor here to talk to us about this condition. We want to learn more about it, doctor. Just explain to us further about
Yes,
this.
definitely. So at Palm Beach Gardens Medical Center, we're predominantly cardiovascular hospital. So we have been bringing new technology and new approaches to treatment of this common condition. In the past, a patient would have to undergo surgery, which is rather traumatic to the patient and associated with long recovery. At this time, we implement the technology that allows us to place the new valve through the very small incision in a femoral artery, allowing patient to go home the next day.
That's fascinating how things over years and over the years that increase in and improvement in technology, a patient can go home the next day. This is something that's so common. Can we talk about the risks here?
Well, the 65% and older patients, about 7% of those who have a severe aortic valve stenosis. Unfortunately, it's a very serious problem because mortality with that is very high. Only about 3% of patients would survive 5 years, so the mortality is much higher than for many cancers. So therefore, the treatment is very important, and that's what we try to implement for our patients.
Talk to us about the recovery like. I know you mentioned just moments ago that you go home the next day, but just further explain.
So recovery is really quick. There's actually no recovery. We do a case in the morning. The next day, patient goes home and resumes normal activity. There may be restriction for about 24 hours, but otherwise they join their family with their normal activities, and they tell me that they feel 10 years younger after the procedure is implemented.
If someone has this severe stenosis, how is that like, or that chance of survival like? What does that look like?
So if they have a severe aortic valve stenosis and it's successfully treated, they resume normal life with a normal life expectancy. The valves, the surgical valve, are good for about 10 years. The TAVR valve, which what we do now, we're talking about transcatheter aortic valve replacement procedure, they last even longer than that. And then we also repair surgical valves with percutaneous TAVR valves. So 20, 30 years and more.
And what do you expect just in the future, the treatments and just the technology advancing? I imagine it's going to get better.
Yes, definitely. It's getting better. We have an influence from artificial intelligence for designing new valves, new technology, and implementing that. And we also are starting doing this at Palm Beach Gardens recently.
All right, doctor. Thank you so much for sharing that with us today.
Thank you.